Happy New Year, everybody. Good to be with you. We're going to take today as a sort of a review of where we are with regard to COVID. And then I'm going to take whatever time we have at the end to talk about what I think employers can expect, some of the highlights that employers can expect for the new Biden administration. So, feel free, as always, chat or Q&A in your questions, and we'll get to everything that we can. So one of the biggest questions we're getting right now on hotline is around FFCRA, the Families First Coronavirus Response Act. We all know that the leave provision expired on December 31st, and we're getting a lot of calls. What do we do now? So just to reiterate what FFCRA is, this is for private employers with less than 500 employees. It has two components. There's an emergency paid sick leave component, so that's 10 days of paid leave. And then there's an emergency extension of the Family and Medical Leave Act, which is an additional 10 weeks of paid or partially paid leave. These are the 6 reasons for the sick leave. The last one, I keep saying no one really knows what that is. It's never been explained, but the other ones are basically related to COVID, either yourself, child who's not in school due to COVID. And so those 80 hours have been available under FFCRA. They were available as paid time with an employer tax credit. And then again, the emergency expansion of FMLA, that was just for childcare. Now, with the stimulus package that was passed, FFCRA was not extended. I think a lot of people were thinking that it would be, and it's not out of the realm of possibility that it still may be. There is some thought that it's not on the highest of priorities, but that at some point in the Biden administration, or at some point in the next few weeks, that we will see this revisited, that it could get extended in full, and that some people are even saying that if it could get extended, it might revert back to January 1st, which could create a whole host of issues. But so stay tuned on that. But even though the mandated leave was not extended, the tax piece was extended, the tax credit piece was extended. So what that means is if you're an employer who previously was covered by FFCRA, you could voluntarily choose to continue your FFCRA leave and then take the tax credit for it. It's not required, but you could take the tax credit for it if you decide to do it. So what does that mean for you? If you haven't made a decision in your organization on how you're going to deal with this FFCRA issue, again, assuming you're less than 500 employees, make that decision now, this week. Consistency becomes really important with all this stuff. As we know, in about 90% of HR law, consistency is hallmark. So you really want to have a consistent approach with all of your employees. So plan now. You might have might want to use FFCRA and extend it. Even if you are not covered by FFCRA, or you decide not to extend it, you may have paid sick leave laws that apply. That gives a little bit of time. That would be Philadelphia, New Jersey. You might also have an FMLA obligation if people get sick enough, or if they have a family member who gets sick enough due to COVID. And of course, always ADA obligations. That may be more for your long haulers or people who develop serious conditions as a result of COVID. So think about how all of that may apply. But also, you really want to be thinking of this through the lens of, we as an employer want to encourage our sick employees not to come to work, right? We're hearing from more and more members that they're having positive cases. And one of the ways to really have an issue, assuming you're an open employer, you've got people coming to work every day, one of the biggest threats to your workforce right now is if someone sick does come to work and infects other people, or puts other people in a position where they need to quarantine, that could seriously affect your business. So you really want to be looking at this through the lens of, what am I going to do to encourage my employees, my sick employees, not to come to work? And so for many employers, the extension of the FFCRA may make a lot of sense. Now keep in mind, with regard to FFCRA, there is not an automatic reset of the time. If your employee has already taken their 80 hours of time, they don't get a new set of 80 hours. If they've taken some of their time or all of their time under the emergency FMLA, whether or not their time resets depends on your own policy. Some employers use a calendar year for their FMLA 12-week or 12-month period. Most employers don't. Most employers will use a rolling calendar, but that's something to look at too. Are employees resetting Do they still have time left? But if they do have the time left because they didn't take the time previously, you may want to consider what are you going to do? Are you going to extend this FFCRA? And really, this all goes down to flexibility. And if you've joined me on other webinars before, I've asked these questions before. What can we do to give our employees flexibility? Because you don't want your sick employees coming to work, but you also don't want to be in a situation where you're losing good employees. You're going out and then you have to spend time, energy, and money on recruiting and training new employees. So what can you do about offering flexibility at work, when and how the work gets done? Can you offer flexibility as far as people working from home, as far as working different hours? What can you do as far as flexibility from work, leave and time off? And then can you help your employees continue with their caregiving programs? I think a lot of schools are trying to get kids back in person, but it hasn't happened everywhere. And even when it does happen everywhere, sometimes there's a pullback, right? And kids will go to school for a little while and then there's a pullback. So you really need to think about that. And then think about your consistency. As I said, consistency is a hallmark of HR law. With a few exceptions out there, you really want to be treating all of your employees the same in this. You don't want to be giving a benefit to one employee who has a child care need and not giving a similar benefit to another employee. For example, you give the benefit to a female employee, you don't give it to a male employee. Now you've got yourself embroiled in a discrimination case potentially. So these are all the questions that you should be asking, but seriously consider whether or not you want to voluntarily extend FFCRA.
So Amy, I had a couple of questions come in and I wanted to just check with you. So, since the FFRCA expired 12/31, if a company wanted to just mirror that from January 1 through March 31st, in order to get the tax credit, do you think the 80 hours and all that resets because, since the first one expired, or you still count that going forward?
Now, 80 hours definitely does not reset. Now, and I'll say all this with the caveat that we've gotten no guidance from the Department of Labor, and we are expecting that in the next week or two. But as far as we can tell, 80 hours do not reset. The 10 weeks of emergency FMLA may reset, but that depends on your own policies and procedures. That depends how the employer counts its FMLA 12-month period. So, and if you're confused, even if you look at your policy and you're not sure how to interpret that, if you're a member, call hotline. We can help you through with that. But basically, if you go on a calendar year, everything resets for FMLA purposes on January 1st. So if you're on a calendar year, your employees are going to reset for that emergency FMLA. If you're on a rolling, no, because that time's only been used since March.
Okay. And someone asked if it's reinstated, would it be retroactive? And like you said, I think it's so not clear at this point because that requires a new administration and that's pretty far down the path. Another question was asked if your employees are working remote, your company's in PA, you're still governed by PA law, even if your employees live in another state. So,
actually, the law has always said that the laws of the state in which you are working control. So, and that gets real interesting right now. There definitely is an argument that if, let's say, your place of business is in Philadelphia, but you have employees who live in New Jersey, there's a great argument that if they've been working from home this whole time, they are covered by New Jersey law. So it's definitely something to think about with regard to paid time off, paid sick leave, those types of things.
Okay.
All right. Okay. So I'm going to go through this kind of quickly. We saw right before the holidays that there were some real tightening of restrictions. The message here is that for the most part, all of that has gone away. So the things that people were really up in arms about right for the holidays, no indoor dining, the indoor gatherings, a lot of that has dropped away as of yesterday. But so we really revert to the guidelines that were put in place by the states kind of end of November, early December timeframe. So we have alerts out on this, and I really wanted to get the slides in here, if for no other reason, so that you would have them, so that you can refer to them. So we revert in New Jersey to Executive Order 192, and that has all these mandates. We're going to have mask wearing and social distancing, providing hand sanitizer for our employees and giving breaks for hand hygiene, cleaning and disinfecting, and your daily health checks, your temp screenings, your symptom checking, all of that consistent with CDC guidelines. And CDC has told us, as well as the Equal Employment Opportunity Commission has told us, you can make a symptom check of your employees as long as you do it for everybody. You don't just target one employee. But you can ask about, temperature, you can ask about symptoms. Just use, again, go on CDC's website, make sure you're getting the latest and greatest with regard to what the symptoms are. And you can ask all those questions. You, of course, want to be excluding your sick employees from the workplace. And when there is a COVID exposure in the workplace, you've got to notify employees. I'm going to talk about that more in a minute under CDC guidelines. And in Pennsylvania, the order, I believe it was November 27th, was issued. It's a little bit more extensive here, but basically the idea is we're back to the impossibility standard, okay? If it is impossible for your employees to work from home, then they should be in person, or they can be in person. That's your manufacturing, that's your retail, that's your restaurants. Otherwise, your folks should be working from home, following CDC guidelines, of course. If employees are in person, you want to have your temperature screening. You want to keep people home if they have a fever of 100.4 or higher. You want to stagger your start and stop times as you can so that you don't have large groups going in and out of the building at the same time. That's your social distancing. Still using social distancing. Stagger your break times, again, so you don't have a lot of people on break at the same time, more likely to mill about. You want to limit your people in your common areas, same thing for your social distancing aspect, and conduct your meetings and trainings or other gatherings virtually. So we've had some questions here at MEA about conducting in-person training. It's really not something that the government wants us to be doing at this time. You want to make sure your employees have access to soap and water, hand sanitizer, make sure that you're giving them breaks on a regular basis to do those things. And of course, face coverings except for during break time to eat or drink. And I know this is a frustration for a lot of employers trying to enforce the mask wearing. And the mask wearing has to come in, sometimes it has to work hand in hand with OSHA requirements, with safety requirements. So if you're not sure about that, you can call hotline if you're a member. We do have a safety partner that we can talk to. There have been some instances, for example, I've talked to members who've said, we've got employees who are wearing masks and wearing safety glasses, and the masks always fog up, and what can we do? And so we can probably help noodle through that and help you figure out some alternatives. Of course, you want to have enough employees on hand to help you enforce all of this. We're keeping non-essential visitors out of the workplace still. Now, this is another big question that we're getting a lot. What do we do when we're aware of an exposure in the workplace, okay? And a lot of times the question that we get a lot is an employee's spouse has tested positive. Employee has no symptoms, employee has not tested positive. Employee was in the workplace yesterday. Is that an exposure? No, unless or until that employee tests positive or has symptoms, because you really need to think about the degree of almost insanity we could get to if we use that standard. So your exposure is someone who is a positive or a presumed positive, okay? Once you are aware of an actual positive test or a presumed positive, someone who had an exposure and is now starting to experience symptoms, you want to do your contact tracing. You want to identify your employees and your customers to the extent possible who are in close contact. What is close contact? It's within about 6 feet, masked or unmasked, for a cumulative 15 minutes over a 24-hour period. And that's with a person who had COVID from a period of 40 hours before symptom onset or test date if asymptomatic to the time when the patient isolated, okay? So this can get tricky, obviously, the contact tracing. I've had many conversations with members who say, all right, we've had an employee test positive in the workplace, but that employee is all over the building and we don't really know who they might have been in close contact with. What do we do? So first thing is to plan ahead for that. You want to be doing some tracking of your employees ahead of time. You want to be limiting where people go in the building unless they're going somewhere for a business necessity. And keep in mind, just walking through the building is probably not going to get you to close contact, right? It's got to be 15 minutes cumulatively over a 24-hour period. It's the person who walks through the building and then stops to talk and has multiple conversations that may last for a period of time. So again, you want to limit all of that from going on, because that makes your contact tracing job that much harder. And you want to keep in mind, when you are doing your contact tracing, Americans with Disabilities Act requires employers to maintain confidentiality. Most employers do not have a HIPAA obligation, but they do have an ADA confidentiality obligation. I know what I hear from most of our members, especially smaller companies, they say, everybody knows who had it. And that's probably true, or they're going to figure it out soon enough. But you don't need to say, oh, Joe tested positive, and then we know you talked to Joe yesterday. We've had a positive case in the workplace, and we know that you were in close contact with that employee. Okay. If an employee becomes sick during the workday, they go home immediately. An employee who has symptoms, obviously, like I said before, what are your strategies to keep those people out of work? The unfortunate thing we know is that when employees aren't getting paid, they're not going to want to stay home. So what are you going to do to make sure your sick employees stay home? An employee who's in close contact with a person who is diagnosed with or has positive for COVID should not be coming in person to work. They should be quarantining. If an employee is diagnosed or tests positive, the employee may no longer work in person. Even if they're asymptomatic, they should be isolating. And that's another thing to sort of hammer home to folks. If you've tested positive, you're not coming to work. It doesn't matter if you're asymptomatic. All right, so now let's talk about people who are exposed to COVID. This is the guideline. It was put out by visiting. This is about our quarantine period. Okay, we always have heard that 14 days is the gold standard, and it still is. But I think the CDC is trying to walk a line here a little bit and try to make sure that employers don't have to be quite as strict, don't have to lose people for quite as long. So under the new guidance, or relatively new guidance, close contact exposure is going to get you a quarantine of 7 or 10 days, depending on test results and symptoms. And again, that close contact definition is for you right there. So again, like I said, 14-day quarantine is still best, but under the new guidelines, here's the alternative. Providing that the individual stays symptom-free, the quarantine is for 10 days following a close contact, or 7 days following a close contact, as long as there's a negative test at least 5 days following a close contact. So if someone's been in isolation for 5 days following a close contact, they take a test, the test comes back negative, and they can stop their isolation period. Okay. And of course, at any point during the 7 or 10 days, or if it's 14 days, you want to make sure that you are maintaining the actual quarantine. So consistent mask usage, social distancing, your hand and cough hygiene, cleaning and disinfection, avoiding crowds, making sure you have adequate indoor ventilation. And if at any point during that time period, if the person does develop symptoms, they're now a positive or presumed case, they need to isolate and be subject to sort of a new quarantine period, a new health guideline period. Okay. In most cases, symptomatic individuals discontinue their home isolation and return to work only after 10 days since symptoms first appeared, and you've got a 24-hour period with no fever-reducing medications and no fever, and other symptoms are improving. And that's the other symptoms are improving. That's recognizing that there are some symptoms that apparently don't improve for weeks, maybe even months. Loss of taste and smell for some people is something that lingers for a long time, but your cough is improving, your congestion is improving, shortness of breath is improving, etc. All right, Kevin, do we want to stop and take questions on that section before I move on to vaccination?
Yeah, that's a great idea. Let me go through these. So someone asked a question, if your employee's been working remotely and they are test positive, so they're not able to work and are on a sick leave. As soon as they feel well enough, they can work from home. There's no time limits. Working from home is very different than coming back to the office. Just wanted to
agreed.
Clarify that.
Now, that person should still be quarantining in their personal life, but we as an employer only have so much control over that.
But you can stop the FFRCA payment once they're well enough to begin working again.
Yeah.
Someone asked a question which is not quite on point, but if you have people that are working at home and are going to be continuing to for quite a while, we're kind of seeing, does the employer have an obligation to help them buy equipment for working from home? And I think we've had these conversations before. It's not required, but companies are doing it and deciding what it's up to the company at this point.
Generally speaking, in Pennsylvania, it's up to the company. In New Jersey, it's up to the company. In some places, it may not be. California comes to mind if you have employees there. But part of it, too, is thinking about that you want to make your employees as efficient as possible. So if we think we're going to be in this for a while longer and you haven't helped upgrade people on their equipment, and maybe something you want to do.
Okay. And then someone asked a question about the reporting of contact tracing. It's either to the county or state Department of Health?
I would start with the county. I know early on in the pandemic, we had employers saying they were calling the county and the county didn't want to hear from them because they were getting information through the testing sites. But it can't hurt to make a phone call to your county Department of Health and get some direction from them.
Okay. And the reporting requirement, if you have a pandemic safety plan, it's a PSO, but if you don't have a PSO, then it's whoever, somebody within the company to do it. You should be, at this point, identifying someone as a PSO in most cases.
Yeah, if you're in Pennsylvania, you're required to have a PSO. Even if you're not in Pennsylvania, I think it's a great idea to designate a point person, and that's probably going to be someone who handles HR for you, or if you're a big enough organization, your safety person. You need to have a repository for all of the information and have someone, and it could be a committee too, have someone or a group of people making decisions.
On that, so if someone's getting if a spouse is getting tests tomorrow, should that person stay home until the results are back? The spouse of that person?
Yeah, well, if the spouse is getting tested tomorrow, they're not required to. If it's presumed positive because they have all the symptoms, then I think they probably should. But if they're testing because they were exposed but they're asymptomatic, there certainly is not a requirement that person stays home. Like I said, one of the problems is that you can take this to a degree of ridiculousness, right? You have people who are, 6 degrees of separation from someone who is positive. At what point do you say, no, we're going to have somebody stay home? So I think if someone calls you up and says, listen, my spouse is, they've got congestion, shortness of breath, and they've lost their taste and smell, and they're going to go get tested tomorrow, yeah, maybe a good idea to have that person stay home today and see what's happening. But it just, my spouse was exposed at work, they're completely asymptomatic, and they're getting tested tomorrow, not necessary.
Yeah, and I think the other option is go ahead. If they do come to work, just try to keep them extra separated from everybody else until they get that result.
Right. Right. And you certainly could keep them home. Tell them, yeah, and especially if they can work from home, this is a good day for you to do your paperwork at home. But you're not required to.
Okay. And someone asked a question, and I haven't seen this before. So if an employee tells you a spouse tested positive, so they're going to quarantine, can you require proof of that? Again, this is probably dealing with the employee that they're not sure is always truthful and things like that.
Yeah, I was having this conversation with a member yesterday. So just, we do need to keep sight of the fact that we as employers want to, we tend to put in place our policies and procedures for the 98% of employees that are honest and not for the 2% that we always think are taking advantage of us. Under FFCRA, if the employee is going to be taking leave, there is information that you can ask for. But generally speaking, it's not proof of the test. And that is for members, we do still have that up on our website in our coronavirus resource center. Generally speaking, no, you're not going to be able to ask for the medical information of somebody's spouse.
Okay. And then someone asked a question when you talked about the different testing time periods, whether it mattered if it was a quick test or the PCR test. There's no separation.
I haven't seen that distinction. I mean, obviously the non-rapid test, for lack of a better term, is considered more accurate. Although I did read somewhere that the rapid tests are considered upwards of 90% accurate. So.
Yeah, I've spoken to someone, they're all over 90% at this point. And again, usually false is a false positive, not a false negative. So.
Right. Yeah. Okay. All right, so let's talk back. Nope.
Someone asked a question whether the sample safety policy has been updated with some of these changes that occurred at this point.
Sample safety policy has been updated in the last, I want to say, I think it has. Yes, I'm going to say yes. I think I updated it at the end of November. So there are some updates there.
Yep. So for members,
believe me,
you can go to members' tools and see that.
Yeah. It's not significant. You know, a lot of what Pennsylvania and New Jersey instituted were things that we were recommending all along anyway. Things like, you know, the mask wearing and temperature checks and things like that. So there's not significant changes.
All right. And one final question. We talked about PA and New Jersey. Amy, is there anything with respect to either Delaware or Maryland that's specific to them that you come across?
I have not looked specifically at Delaware or Maryland. I think most states, certainly most states in the Northeast, are doing things very similar to what Pennsylvania and New Jersey are doing. They want, you know, obviously mask mandating and screening of employees is becoming more and more important.
Okay.
All right. So let's talk vaccination.
Yeah, I was going to say, someone asked a vaccine question. We're going to wait until you go through it.
Yeah. All right. So for a lot of us, it's a time to rejoice because the vaccines have started, right? We started seeing shots go in arms, and the thought process is, again, depending on how quickly the vaccines are distributed, a lot of us could be in line to get vaccines by springtime. So what does that mean for employers? You know, should we require the COVID vaccine? And this is a policy decision for the most part that you're going to need to make. Some things to think about while you're making it. First of all, it obviously is limited availability. To say right now we're going to mandate the vaccine unless you're a healthcare provider, how are you going to mandate something that people can't get, right? You can, however, establish legitimate health and safety requirements that are job-related and consistent with in years with healthcare providers in the flu shot. For many years, healthcare providers have mandated the flu shot. Always, no matter what you do, you're going to have to allow for reasonable accommodation and an interactive process under the Americans with Disabilities Act on the basis of disability, or Title VII on the basis of religion. So keep that in mind if you do decide to mandate. But what approach do you want to take? Do you want to take a carrot approach, or do you want to take a stick approach? Because what I always say is, and we talked about this back in the fall with flu vaccines, if your employees, you know, if you mandate it and your employees say no, then what? You're prepared to fire people. And it could be based on what we're seeing right now in polling, it could be 10, 20% of your workforce, maybe even more, who says, nope, I'm not taking that. Are you prepared to fire those people? And like I said before, go through the time, money, and energy of recruiting and hiring new and training new people. And then the legal challenges, they're going to come. We've had legal challenges for years and years around the flu vaccine being mandated, and we're going to get it too with COVID vaccine. And so I don't think a small employer wants to be the test case. I don't think, again, time, energy, and money. I think we want to leave that to some of the big boy employers out there, let them fight that battle and see what happens. What I really think is the carrot approach is much more advisable. We've got some great CDC information that we're going to send out this afternoon with our email. Educate your employees, all right? There's plenty of people out there who do not understand why the vaccine is so important. So start with education. Cost. You know, talk to your healthcare provider, talk to your insurance company, make sure that this is going to be a no-cost or low-cost situation for your employees. I think it is. I think in most situations, it's going to be a no-cost situation. Tell your employees that. And then make vaccination easy. You know, I'm not sure exactly what this is going to look like, but it may be that we get to a point, especially once we get vaccines that don't require this intense refrigeration. It may be that we get to a situation where we can have vaccine clinics in our offices, just like we have flu clinics. But make it as easy as you can. So either you bring the vaccine to your employees or you give them a list. You know, once this is more widely available, these are the places you can go to get the vaccine. This is what you have to do to sign up online or whatever to get an appointment. And then maybe you give them an hour of paid time off to go get the vaccine. Make it as easy as possible. To me, the carrot approach is probably going to work better in most situations rather than the stick approach. Now, if you're a healthcare provider, if you're sort of a frontline worker type situation, that may be different. But to me, for most of us, the carrot approach is going to be better. All right. Do you have any questions about vaccination, Kevin?
We do. Let me kind of look at these. We're kind of going a little bit across the board. So someone asked about the tax credit, that we should include proof of a positive test to validate it. Again, I think we're going to get the guidance for that coming out. It's not out yet from the post.
And keep in mind, for the tax credit purposes, I think what, as Kevin said, we're going to get more guidance on this, but I think what you're safe asking for is the same stuff that you asked for before under FFCRA. And like I said, for members, we've got a great form in our member tools, in our Coronavirus Resource Center. You can go there and grab it. If you can't find it, email Jane on hotline. She'll find it for you.
Someone asked a question, if an employee tests positive, can you require a negative test before they come back?
That's not the standard being used by the CDC. As long as they go through their quarantine period and their symptoms resolve, subside, and they are fever-free, they're supposed to be able to come back to work. So I don't know that I would try to do that as an employer, especially because there are a lot of situations where insurance companies are not paying for tests, and after you're telling an employee they have to go out and spend $100+ on a test, I don't think that makes sense.
Okay. And someone asked the question of, do we have to let employees know that the FFCRA has expired? I believe that everyone has the poster that I think on its terms told you it was through 12/31. So I would wait until you know what you're going to do post 12/31, I would say.
Agreed.
I had a question here that this company is going to be a manufacturer that falls in phase 1B. Is there any sense of how employees are going to prove that? I don't know if we know that at this point.
Oh, you mean proved so they can get their vaccine?
Yeah, right.
That's an interesting question. Yeah, I'm not, seeing how this whole thing has been rolled out, it appears that at least some places have not put a lot of thought into how they're going to do this. So it's a great question. I don't know. Yeah.
So we'll keep an eye on that, Karen, for you. But we're ahead of the curve on that one. All right, I think we're ready.
That's
to move
a great
forward.
question.
Yep.
Okay, so we have a little bit of time left, and I only did one slide on this, but this is for me, the big things I think that we're going to see that are going to be different under the Biden administration. There's the potential for federal paid leave. Obviously, FFCRA extension hangs out there as a mandation. But Biden also campaigned on paid sick leave and paid family leave. So we'll see what, if anything, can be done with that or will be done with that. A lot of states and a lot of municipalities have implemented paid sick leave. A fewer number of states and municipalities have instituted paid family leave. Is it possible that we'll get that on a federal basis? That's a wait and see. Definitely think we're going to have immigration changes, and some of the immigration situation is still up in the air because of COVID, and there's much less international travel than there once was. But I think we're going to see a much more immigration-friendly administration with the Biden administration. We are going to have Chris Thorne from Buchanan. He is our immigration partner. He's an immigration attorney. He's awesome. If any of you have ever talked to him or if you've seen him speak, he's been at our law conferences in the past. We're going to have him on at the end of January, and he's going to come talk about what he thinks the changes we're going to see under a Biden administration with regard to immigration. So stay tuned on that. Department of Labor has been kind of quiet the last 4 years. I think we're going to see that change. Federal minimum wage has not changed in years and years and years, $7.25 an hour. I think there's going to be a push to raise that. One change we did see in the last couple of years is the salary threshold for exempt employees under the Fair Labor Standards Act. The current salary threshold, it was raised from about $24,000 a year. It's currently at $35,000 a year. You remember under the Obama administration, they tried to change it to about $47,000 a year, and that got knocked down by the courts. Currently, as I said, at $35,000 a year on a federal level. Some states have a higher threshold. I think we're going to see some push from the Biden administration to try to raise that again. And to one of the things that President Obama had wanted to do, and I think President-elect Biden has talked about also, is have an automatic increase every several years. So stay tuned for that. And then if you remember, about 10 years ago, the worker misclassification situation was really, really prevalent, really, really important. Happens when the economy is bad, especially. The government is looking for its tax money, okay? So when you have employees classified as independent contractors and they're not necessarily paying taxes, or you as the employer are not paying taxes, the government starts to sniff around for that money. So I think we're going to see more and more on the independent contractor front and the exempt versus non-exempt under the FLSA front, more and more misclassification. So if you've gotten a little bit lax in the last 10 years, I think a lot of employers tightened this up a lot during the Obama administration, but if it's gotten a little lax in your workplace in the last several years, this is maybe put this on your list of things to think about, things to look at. We can help you with that if you're a member. I think we're definitely going to see a more active OSHA. OSHA's been pretty quiet over the last 4 years. We'll see a more active OSHA with regard to COVID, but also just generally. And we are going to have Erin Rimza from CMI, our safety partner. She's going to join us in early February for one of these webinars, and she'll talk more about that. And then marijuana. It's becoming legal in New Jersey. They're still working out the details, but recreational marijuana is becoming legal in New Jersey. I think there's going to be a push now on a federal level, at least to decriminalize marijuana, to get it off the bad list, so to speak. So stay tuned for that. That should get really interesting, because one of the things that employers have kind of hung their hat on, even if you're a state with legal, medical, or recreational marijuana, employers have always been able to say, yeah, but we test because it's still illegal under federal law. So I think you will see a push to try to at least decriminalize under federal law. So stay tuned for that. And then finally, unions. This is not a big issue for a lot of employers, but if you are an employer with a potentially unionized workforce, this was one of the big things that happened in the first 6 months of the Obama administration. There was a big push to make unionization easier. Some of that got rolled back, obviously, but I think you're going to look to see that again with the Biden administration to try to make it easier for unions to be recognized just through authorization cards, to reduce the time period for an election, how long it's from the time that you get a certification or a petition to the election, all the things that can make unionization a lot easier, something to look out for as well. So if you are an employer who's been sort of open to unionization before, or open to the unions kind of coming around and trying to unionize your employees, and that's something you don't think you want, good time to look at it now, to look at your policies, practices, procedures around that. So what can we do to tighten things up to make sure, you know, at the end of the day, to make sure that our employees are happy and they're not turning to a union for additional support. That's sort of the down and dirty. We'll be talking more about that, I think, as the months go on. But Kevin, do we have any questions around this slide?
Just one. Someone asked about what do we think will happen with healthcare, and again, I think we're going to not see too much that was trying to be changed over the last 4 years, and you know, we're going to pretty much stay with the Obamacare, I would think.
Yeah, I would think that Biden would try to improve Obamacare. I don't think it's going away, though.
Right. Yeah. All right, that's it. Amy, great summary. You took the full 45 minutes. We're glad to have everybody back with us, and we will see you every week. And again, as always, if you are an MA member, you feel free to call the hotline and legal and get specific advice on any of these things we talked about today. Have a great week and stay healthy.
All right. Take care, everybody.